Good afternoon, everyone. This is Mick Stewart. Quite a few of you have asked about some help with drug calculations, some reviews. So I'm going to give you a couple of presentations. The first one we're going to start off with is for IV pushes. Then I will do a second presentation on how to do IV infusions. I am going to blank out my camera just so it's not confusing because I'm going to be bouncing back and forth between two different screens. Okay, first thing we want to talk about is the information that we need to know before we are doing an IV push. First thing we're going to need is our doctor's orders. Now, most of this is going to come from our protocols, our standing orders, information you should easily have reference to or learn during your training. You may also have to get direct online medical direction, maybe contact Dr. Hartman for special case situations. Generally, these doctor's orders are going to come in, administer however many milligrams to your patient IV push. It may be in the form of milligrams per kilo. It may be micrograms or milliequivalents per kilo. It may be in units, but for the most part, it's going to either be milligrams or milligrams per kilogram. You're also going to need to know what your drug concentration is. Now, this is very important that you are looking at the drug concentration that you actually are holding in your hand at that time. Agencies may change providers for different medications that they're receiving, so your drug concentration may change, so you can't always rely on what you've used in the past. You need to actually look at your drug in hand and see what you've got. Now, my examples here, we've got diltiazem on the left. You see this is 25 milligrams in 5 mLs. That is what you have total in that vial. You've got a total of 5 milliliters also marked right there on the vial. You have 25 milligrams total. Kind of visualize in your head that I've got a big pill, a 25 milligram pill that has been crushed up and dissolved in this 5 milliliters of solution. Now, if I took a syringe and I drew out 1 ml of solution, I've got 5 milligrams in that, and that's what you see over here represented on the other portion of the vial. Now, you can really use either one of these when you're doing your drug calculations. You will get the same answer if you do it correctly. My recommendation would be that you use the one that's the smaller, that is the per milliliter concentration, because it's going to be smaller numbers to work with. On the etomidate on the right side, we see that all told, we've got 20 milligrams in 10 ml. You see our vials holding 10 mLs right here. But again, if I took a syringe and I drew out 1 milliliter of solution out of this vial, I would have 2 milligrams in that solution. Finally, if it is a weight-based drug, if your doctor's orders come in the form of give so many milligrams per kilo, then you're going to need to know what the patient's weight is in kilograms. You're going to accomplish this by dividing by 2.2, and I'm going to switch over and just give you a quick refresher on doing that. So I'm going to switch to my other screen, pull up my whiteboard, make sure you all can use that. And I'm going to blank this off so you're not seeing me bounce back and forth between screens there, maybe make it a little bit easier. And so let's just say that we've got a patient that weighs 220 pounds. That would be basically your average, pretty good size adult male, not extremely obese, but just a good size adult male. So 220 pounds, we want to know how many kilograms this patient is, okay? We're going to take our 220 pounds and we're going to divide that by 2.2. So 220, I'll put a decimal point there, add a few extra zeros. Now I've got my decimal point here on the outside of the box. I'm going to move that over one space on the outside. I got to do the same thing on the inside of my box. So we know that 22 goes into 22 one time. That's 22, 0. Our 0 comes down. Just a little refresher on long form multiplication and division. 22 goes into 0 times. The next 0 comes down. And finally, again, 22 goes into 0 times. So our 220 pound patient weighs 100 kilos. Again, average size adult male. I'm going to do one more for you. Let's just say that we've got a 176 pound patient. 176 pounds. We want to know how many kilos that is. Again, we're going to take our 176 pounds, put a few extra zeros on there, and we're going to divide that by 2.2. Now again, I want to move my decimal point outside the box. move my decimal point inside the box. 22 will not go into 17. We're going to do some quick calculation in our head. We're going to say that 22 goes into 176 8 times. 8 times 2 is 16. Carry our 1. 8 times 2 is 16. 17. So we've got 176 minus 176 is 0. Bring our next 0 down. 22 goes into 0 times. So our 176-pound patient weighs 80 kilos. Sorry, I'm not super great with a stylus on here, but you get the idea. 176-pound patient weighs 80 kilos. So before you do your calculations, if it is a weight-based drug, you're going to need to convert that patient's weight. Now, one more little point on that. We're saying a weight-based drug. Again, that's so much drug per unit of weight the patient is. Let's just say if my doctor's orders are to give 1 milligram per kilogram to a patient, if my patient weighs 10 kilograms, then my patient's going to get 10 milligrams of drug. If my patient weighs 50 kilograms, then my patient's going to get 50 milligrams of drug. That one's pretty easy. Change it up a little bit. If my doctor's orders are 0.5 milligrams per kilo, if my patient weighs 25 kilograms, I'm going to say half of 25 is 12.5, so my patient's going to get 12.5 milligrams of drug. If my patient weighs 50 kilograms, then my patient's going to get 25 milligrams of drug. If my patient weighs 80 kilos, that patient's going to get 40 milligrams of drug. So you get the idea there. But again, if it is weight-based, it is so much drug based on each individual unit of patient weight. All right, I'm going to switch back over to my other screen. We're going to be bouncing back and forth between screens a lot, so just bear with me. Let's go ahead and look at our first example. So first example is labetalol. We are ordered to give 20 milligrams of labetalol. Our drug has a concentration of 100 milligrams in 20 mLs. Now again, you can see right here on my box or on my packaging, right here's my concentration, 100 milligrams in 20 mLs. It's also expressed as 5 milligrams per milliliter. Again, if I took a syringe, drew out 1 ml, I would have 5 milligrams in it. Now I told you earlier, I recommend using these smaller numbers here to do your calculations with if you have it available. But since our equation is giving you this information, that's what we're going to go with. All right. So our doctor's orders are to give 20 milligrams of drug. So 20 milligrams of labetalol, and our drug concentration was 100 milligrams in 20 mLs. Now, I can write that one of two ways. I could write, don't write this down yet, but I could write 100 milligrams over 20 mLs. The problem is I've got milligrams on the top here and milligrams on the top there. I can't mark those out. I need those milligrams to go away so that I'm left with milliliters. The reason for that is I've got to be able to calculate how many milliliters, how much solution to draw out of my syringe, how to push out of my pre-fill, whatever device I'm using. So I need my milliliters to be on top. So I'm just going to clear this off real quick and we're going to start over. I'm going to give 20 milligrams of labetalol and I'm going to invert my concentration. Now again, the reason I can do that, think about your vial. I can express it two different ways. I can say I've got a vial, I've got 100 milligrams dissolved in 20 mLs, or I've got 20 milliliters of solution with 100 milligrams of labetalol dissolved in it. I'm saying the same thing either way. So on my equation, I'm going to write 20 mLs over 100 milligrams. Okay, now the first thing I want you to look at are your units. I want to mark out any units that are the same. So I've got milligrams on top, milligrams on the bottom. I'm going to mark those out. Now, I'm left with milliliters on the top, and that's what my question ultimately is. Again, how much solution, how many milliliters of labetalol do I need to pull out of this syringe, or I'm sorry, out of this vial that contains 20 milligrams of drug in it? So once I've got milliliters on the left side of the equation and milliliters on the right side of the equation, I know the equation is set up properly and I can proceed on. The next thing I want to do is use this little trick of marking out zeros. Any zero that I've got on top and bottom that match up, I can mark those out. So I've got 1 0 on the top's gone, 1 on the bottom's gone. 1 on the top's gone, 1 on the bottom's gone. Now, instead of multiplying 20s, dividing by 100, I've got 2 times 2, which equals 4. And I've got 1 on the bottom, so 1 goes into 4 times. So my answer is 4 milliliters. I've got to draw 4 milliliters of solution out of this vial of labetalol to be able to deliver 20 milligrams of drug to my patient. All right, we're going to switch back over to our next presentation. Next question. Okay, next one is we're going to be administering naloxone. We're being asked to administer 1 milligram of naloxone to a 50 kilo unresponsive patient who is likely not breathing or not breathing well. The concentration is 0.4 milligrams per milliliter. Now, I've given you the patient's weight in here, but notice this is not a weight-based calculation. It doesn't say give 1 milligram per kilo. It just simply says give 1 milligram of Narcan to this patient. So the 50 kilo, knowing that patient's weight is really just extraneous information, but I want you to be able to understand that concept of we're not being asked for milligrams per kilo, it's just straight milligrams here. So when I switch over to do my calculation, I apologize, I'm getting email pop-ins as well. Go back to my whiteboard. All right, we're going to clear this one. So I'm asked to give 1 milligram of naloxone, and my drug has a concentration of, remember I'm going to flip it up, I've got 1 milliliter and 0.4 milligrams of drug in that 1 ml. Now again, forgetting the numbers right now, just looking at the units, I've got milligrams on top, milligrams on bottom, I'm left with milliliters on top. That's what my question is, how many milliliters? So I'm going to say 1 times 1 is 1. I don't have any zeros I can mark out at this time. I'm going to divide that by 0.4. Now these decimal points tend to freak people out a little bit. Let's just again review that long division. 0.4 into 1.000, just give myself some extra zeros. Move my decimal point here, move my decimal point here. 4 doesn't go into 1, 4 goes into 10. 2 times. 2 times 4 is 8. 10 minus 8 is 2. Bring the 0 down, that's 20. 4 will go into 20 5 times. So my answer is 2.5 milliliters. Now, pay attention again. This started out with a vial of 0.4 milligrams in 1 ml. That's what my vial, that's everything that's contained in my vial. I've got to give 2.5 milliliters. What that means is I don't have enough drug in this vial. I'm actually going to have to get 3 vials of this drug. I'm going to have to give 1 milliliter out of one vial, another milliliter out of another vial, and then half a milliliter out of the final vial to be able to give enough drug to my patient. Leave that up there for just a moment so everybody can review that. And going back to my other screen. Okay. Next problem. We're going to be administering succinylcholine, 1.5 milligrams per kilo. So this is a weight-based drug. Also, I know some of you are a little anxious right now because you're going, well, succinylcholine is not in my protocol. I can't do this. Succinylcholine is within your scope of practice as a paramedic provider. Just because your agency may not administer it does not mean it's not within your scope, and does not mean you should not know how to properly administer to your patient. So again, we're going to be giving 1.5 milligrams per kilo to an 80K patient. We have a drug with a concentration of 200 milligrams in 10 mLs. How many milliliters do we administer? All right. So 1.5 milligrams per kilo, weight-based drug. This is our doctor's orders. I want to now flip my concentration. So I've got 10 milliliters with 200 milligrams in it. And finally, I've got that patient's weight of 80 kilos. All right. So again, forget the numbers right now, just looking at the units. I've got milligrams on top, milligrams on bottom, kilos on top and bottom, so I'll mark that out. The only unit that I have remaining is milliliters, and that is ultimately, again, what my answer is going to be. How many milliliters? How much do I draw up? Now I can do the little zero trick again. I've got a 0 on the top, 0 bottom, 0 top, 0 bottom. So now instead of having to multiply 10 and 80 and 1.5, I've only got to multiply 1.5 times 1 times 8. 1.5 times 8 is going to be 12, and 2 times 1 times 1 is going to be 2. Whoop, don't know what happened there. Let me see if I can erase that off. Okay. I've got 2 on the bottom, so 2 into 12 goes 6 times. So I've got to draw up 6 milliliters of succinylcholine to administer 1.5 milligrams per kilo to my 80K patient. I feel like I really want to ask you all questions, and I'm sure you will email me or call me with questions later on, and that's completely good. All right, next one. Administering flumazenil 0.2 milligrams with a concentration of 0.5 milligrams in 5 mLs. Hopefully you all have heard and studied a little bit about flumazenil. If you're not, just a quick reminder. This is going to be an antidote drug for benzodiazepines. Again, it is a medication that is on your state formulary. You generally don't find it in any protocols. The reason being, we used to carry it on the truck, but they pulled it. The big concern was patients who may have seizure disorder and are taking some type of benzo to try to suppress those seizures. If we reverse the effects of their benzo, we may actually produce a seizure in the patient. So that was one of the primary reasons for pulling flumazenil off the truck. They just said that we can manage the patient otherwise, manage the airway, support ventilation as appropriate. So 0.2 milligrams of flumazenil, concentration 0.5 milligrams per ml. All right, 0.2 milligrams of flumazenil, and we've got to administer, we've got a vial with 5 mLs and 0.5 milligrams in it. Now I know you all are seeing 2 decimal points here, 2 different numbers with decimal points, and that's freaking a lot of people out, giving you a lot of anxiety. Probably need a little benzo to calm you down there. Oops, let me take that out. Okay, so first thing we do, we mark out milligrams top and bottom. We're left with milliliters on the top, so that's what our answer is going to be expressed in, how many milliliters. Milliliters on the left side of the equation, milliliters on the right, the equation's set up. Now we've got a little bit of funky math here to do. Again, that's going to stress some of you out, but if we multiply 0.2 times 5, 0.2 times 5 should give us 1. I'm just going to write that up here. And we're going to divide that by 0.5. That looks really bad. Let me fix that. Okay. 0.5. That looks a little bit better. Okay. All right. 0.5 is going to go into 1 2 times. So out of this vial of 5 milliliters, we've got to draw up 2 mLs to administer 0.2 milligrams of flumazenil to our patient. Give you just a moment to copy that down. Think of some questions to call me with. And we're going to go back for one more. All right. We're going to try one more right here. We're ordered to administer 0.01 milligrams per kilo of epinephrine, 1 to 10,000, with a concentration of 1 milligram in 10 mLs to a 33-pound pediatric patient who is in cardiac arrest. So this is your cardiac epi. This is the one that's going to be in the pre-fill. It's not going to be in the ampule of 1 milligram per ml. This is your 1 milligram in 10 ml vials you can see in the image there. Let's clear all this out. So again, decimal points tend to freak people out, but I'm going to work with you to get through it. So we've got 0.01 milligrams of our drug per kilo. Now let me just pause because I forgot a step here. We've got a 33-pound patient, and we got to figure out how many kilos that is. So 2.2 into 33, put a few extra zeros in there. All right, move our decimal point over. 22 goes into 33 once. That's 22. Didn't leave myself a whole lot of room here. 3 minus 2 is 1. 3 minus 2 is 1. That's 10. 22 goes into 110 5 times. So our 33-pound patient weighs 15 kilos. So I'm going to take all this stuff out right here. Makes a little more space. All right, so you want to kind of figure that out on the front end. So back to our equation, 0.01 milligrams per kilogram. I have 10 milliliters with 1 milligram of drug in it. And I have a 15 kilogram pediatric patient. Okay, milliliters are gone top and bottom. Kilos are gone top and bottom. I'm left with milliliters on the top on the left side. And that's what my question is, how many milliliters on the right side of the equation? So I can't mark out any zeros here, so I just got to do straight math. 0.01 times 10 is going to be 0.1 times 15, and all that's going to be divided by 1. 0.1 times 15 is 1.5 divided by 1, which is still going to be 1.5. So out of my 10 ml pre-filled syringe here, my Abiject, I've got to draw up 1.5, or I've got to push 1.5 milliliters into my pediatric patient who's in cardiac arrest. All right. Now, just went through 5 different IV drug pushes. I've got 5 more for you that I'm going to let you do on your own time. Okay. Try to get this done maybe within the next week. If you've got any questions about this, I'll get this posted up. I'll have Jeremy and Billy post these up for you in Blackboard, or I'll post them up in Blackboard. Please email me, give me a call if you've got any questions or concerns or running into any issues, something you don't understand with these. But again, go back, review this video, look at how we did each one of those preceding that I just talked you through, and you should be able to get through the next 5 with no issue. Do your best to do these long division, long multiplication at first. Write them out, because again, that's a skill that you're going to need. I expect when you're working on a truck that you're going to have 1 or 3 calculators available to you, and I expect you to use those. But again, if you don't understand how to set the equation up, then a calculator is completely useless to you. So make sure you work on that you feel comfortable with doing long multiplication, long division, that you can do that in pretty rapid format, but definitely check yourself with a calculator as well. And again, especially when you're practicing the field, make sure you got those calculators with you, because you want to take anything off of you that you can as far as stress and things that you can focus more on your patient. You guys take care, be safe, and we will talk really soon. Be looking for my next presentation on IV infusions.